Hello everyone, my name is Leo. I will be introducing our case study today. My group and I will be discussing case study number 12. The recreational use of cannabis in Canada was legalized in 2018. In many cities like Guelph, there are dispensaries that sell cannabis under government regulations to individuals 19 and over. Due to significant evidence in the literature, it has been known for decades that smoking and alcohol consumption should be avoided during pregnancy. It can have detrimental effects on the developing fetus. Should cannabis be an exception? A large Canadian study recently presented data indicating that cannabis use in pregnancy may increase the risk of autism spectrum disorder in children. There are also trends towards increased risk for intellectual disability and ADHD. Throughout this case study, we aim to answer the following questions. Considering the risks mentioned, should the Government of Canada provide the same warnings they provide for alcohol and tobacco use during pregnancy? Should cannabis providers be required to warn women about potential use in pregnancy at the time of purchase? Lastly, is there a case for revisiting the approval of cannabis as a recreational drug? The psychoactive component of marijuana is delta-9 tetrahydrocannabinol, or THC. Cannabidiol, or CBD, is the second most common cannabinoid and is currently being studied for medical use in pain and anxiety relief. Cannabis can be consumed in many forms, two of the most common being eaten in an edible form or smoked. The use of cannabis can be medical or recreational. Medical cannabis is strictly regulated and prescribed by healthcare professionals for management of symptoms associated with chronic conditions. For example, Alzheimer's, cancer, HIV, or AIDS. Recreational use is more for personal enjoyment. Individuals self-medicate with cannabis to cope with stress and anxiety, but this often creates a dependence for stress and anxiety relief, and this can progress into substance abuse. Substance abuse refers to the excessive abuse of a drug like cannabis. Cannabis is the second most commonly used substance in Canada, right after alcohol. Cannabis is the drug most commonly used in pregnancy as well. This use may be a result of the stress and anxiety experienced during pregnancy. Erin will now be discussing the pharmacology and effects of cannabis.
Thanks, Leo. My name is Erin, and I'll be discussing the pharmacology and effects of cannabis. Cannabis potency is primarily evaluated according to the sample's THC concentration. As previously stated, THC is the primary psychoactive cannabinoid found in cannabis. THC is highly lipophilic, thus, once consumed, it gets distributed and absorbed in the adipose tissue, liver, lungs, and spleen. Cannabinoids exert their effects by binding to endogenous cannabinoid receptors, CB1 and CB2. CB1 and CB2 receptors are 7-transmembrane G protein coupled receptors. As shown in the image, CB1 is distributed throughout the nervous system and mediates psychoactivity, pain regulation, memory processing, and motor control. Activation of CB1 results in activation of potassium channels, which act to decrease presynaptic neuron firing and inhibit voltage-sensitive calcium channels that under normal conditions would decrease neurotransmitter release. The CB2 receptor is found predominantly in the periphery and tissues and immune cells of the nervous system. This receptor contributes to the slowing down of chronic inflammatory processes and modulates chronic pain. The main effect seen with cannabis use is the production of a euphoric effect, resulting in decreased rates of anxiety and depression. Effects of cannabis on the developing fetus. Marijuana use during pregnancy may be harmful to a baby's health and cause a variety of problems, including fetal growth restriction, greater incidence of stillbirth, preterm birth, low birth weight, and long-term brain development issues impacting memory and learning. THC enters fetal circulation by crossing the placenta, passing through the blood-brain barrier, and is found at the highest levels in fetal fat tissue. THC consumed during pregnancy can have both obstetrical outcomes and affect embryonic development. In terms of obstetrical outcomes, evidence suggests that cannabinoids can affect fallopian mobility, cause ectopic pregnancy, and decrease uterine receptivity. In regards to embryonic development, folic acid uptake was found to be reduced. I will now introduce Marco. He'll be covering the health risks associated with infancy.
Thanks, Aaron. My name is Marco, and I'll be going through some infant specific health risks associated with prenatal cannabis exposure. A 2020 study by Dr. Daniel Corsi and his team examined the correlation between prenatal cannabis exposure and autism spectrum disorder, or ASD, and showed that the incidence rate of ASD diagnosis was 4.0 per 1,000 person years among children exposed to cannabis and 2.42 among unexposed children. This same study also examined the impact that prenatal marijuana use has on secondary neurological effects, which they defined as intellectual or learning disorders and ADHD. The incidence rates for children with prenatal exposure to cannabis was 10.3 and 45.0 for intellectual/learning disorders and ADHD respectively, while the incidence rate for unexposed children was 4.9 and 17.1 respectively. Also, as Aaron previously mentioned, THC significantly decreases folic acid uptake. This has impacts on both obstetrical outcomes and embryo development. Low levels of folic acid correlate with increased rates of miscarriage. On the embryonic level, decreased folic acid uptake can lead to neural tube defects and a decreased birth weight in infants. Another important factor is the marijuana on the market today has a drastically increased THC content, being only 4% in 1995 while it's all the way up to 12% in 2014. This table comes from DEA confiscated samples of marijuana. Unfortunately, many of the studies on marijuana use in pregnancy were completed when the THC concentration was much lower, meaning that their results may not be applicable in the same way. Also, new ways of using marijuana, such as concentrated extracts, allow exposure to even greater concentrations of THC versus smoking or edibles. Smoking and drinking alcohol notoriously have negative impacts on the development of the fetus, and some of these specific outcomes include, for tobacco, increased risk of placental detachment and premature birth, slowing fetal growth and decreasing birth rate, and increasing the risk of having a stillborn. For alcohol, they include an increased risk of miscarriage, preterm birth, and having a stillborn, all while also having negative effects on fetal organ development, and can also lead to learning, memory, behavior, and attention deficit disorders. The negative impacts of tobacco, alcohol, and cannabis consumption during pregnancy have quite a bit of overlap. However, they're treated much differently by regulations and society.
Thanks, Marco. So, my name's Omar, and I'll be taking you through our stance regarding the case questions that Leo brought up earlier. As a refresher, I'll leave this slide up for a few seconds so you can take a look at what we'll be covering. So, when we answered these questions, we tried to consider government action. There are societal perspectives that frown upon substance use in this specific population, but are there government mandates in place to prevent this from occurring? To answer the first question regarding whether cannabis use should provide the same warnings as alcohol and tobacco, we'll first take a look at the policies in place for the two substances compared. No laws are put in place to incriminate pregnant women for drinking alcohol or smoking tobacco. Instead, alternative laws are put in place to try and prevent pregnant women from indulging in these substances. With alcohol in Ontario, we have Sandy's Law. This falls within the Liquor License Act and requires alcohol serving premises to display signs that try and deter pregnant women from drinking by informing them how it may lead to fetal alcohol spectrum disorder. These signs have to follow specific guidelines and regulations, complying with the Alcohol and Gaming Commission of Ontario. You can see an example of a poster you may have noticed within a restaurant or the LCBO. When it comes to tobacco, it has been a law to include health warnings on packaging of cigarettes and small cigars for many years now. These warnings are required to include the content of the product, potential impacts, and they must cover 75% of the packages. There are various health warning images that either discuss addiction, effects of secondhand smoke, or health impacts. This slide shows an example of a label that warns against use in pregnant women. When it comes to cannabis use, Marco and Aaron have identified how this may affect children. Given all of this information, in Ontario and the rest of Canada, there is little information presented on the packaging of cannabis products. No information on any potential impact is presented upon the purchase from licensed cannabis dispensaries, other than the statement that it may harm the baby and result in low birth weight if the products are used by pregnant or breastfeeding women. As you can see in this image, the warning label is small and it's a bit hard to see. This is something that we believe will change with time, similar to how it did with alcohol and tobacco. With all the information presented, we believe that governments should be providing the same warnings to Canadian women regarding cannabis use similar to how it is currently provided for alcohol and tobacco. This means that we believe that warnings should be presented on the packaging of cannabis products purchased directly from a dispensary. We believe that these warnings should be clearly identifiable. We do not believe that providers should warn women about the use in pregnancy at the time of purchase, as this infringes on their rights and requires many assumptions from the sales clerk. The addition of signs at the checkout counter may be more beneficial in these cases. When it comes to revisiting approval of cannabis as a recreational drug, we believe that this should not be the case. Rather, we think that information regarding potential impacts should be easily accessible in order to not only educate pregnant women, but the general public as a whole. We will now leave the floor open to any questions regarding our case study. Here at the bottom, we have relisted the case questions so that we can get your take on the matter. All individuals are entitled to their own opinions, so we're curious to hear what you all think. Thank you for listening.